Okay, everybody. My name is Maddy Davis. I am an accelerated Master of Public Affairs student at CU Denver, and I'm really excited to get started with our second installation of the Social Equity series. So this second edition of the series is going to focus on social equity in child welfare. And we're really going to be focusing on anti-oppression and anti-racism within this sphere. And we have some really great panelists. I'm going to hand it off to my other moderator, Daniella, to introduce herself, and then we'll get started with introducing the panelists.
Hi, everyone. My name is Daniella Goudreau. I'm also an accelerated Master of Public Administration student. We're going to go ahead and get started with introducing all of our panelists. If I could have all of the panelists do an introduction, going a little bit into their background and what got them to be in the sphere of child welfare. And we'll go ahead and start with Adrian, and then we'll just go around.
Hi, everyone. Thank you for inviting us and inviting me to be here. Clarification on the background, you want educational and or just my journey up to child welfare?
Just your journey.
Okay. Simple, it's by invitation. I think it was at a time where professional relationship, one of my colleagues brought up the idea to bring about my skills and my lived experiences in service of people, in service of children. So that started my journey in child welfare about 8 years ago. That led me to do ongoing work in Mason County, Colorado, where I used to live. Following that, I received the opportunity to join the Kempe Center. So for the past almost 6 years, I've been with the team on the training and development, coaching, and just recently received an appointment as faculty within the team as well. So here I am, and it's been a short journey, and I'm very grateful that this is where life led me to.
Awesome, thank you. Colleen.
Hi, everyone. I'm Colleen Gibley-Reed. I use she, her pronouns, and I have been in child welfare for the past 27 and a half years, which is super, super strange to me because I feel like I'm still 27. I kind of fell into child welfare, or child welfare kind of found me. I started out as an intern when I was getting my undergrad and fell in love with child welfare and decided to stay. So I did direct practice for about 19 years with Larimer County up here in Fort Collins, Colorado, doing everything from family preservation work to child protection to foster and kinship care work. And then my last 5 years, I was a trainer and practice coach. And then I switched over to the Kempe Center, and I'm on the same team as Adrian, the Colorado Child Welfare Training System Project, where I have been for the last 8.5 years. And I'm really grateful to have this opportunity to be here today.
Thank you. MJ?
Yes, hi. Thank you so much for having me. My name is MJ. Very similar to my colleagues, it just kind of happened that way. The child welfare system was not a system that I ever wanted to touch. But it was my first job out of graduate school. And when I moved to Denver, so I ended up doing this work as my first job as an in-home therapist, and then progressed to working as a consultant with attorneys. So.
Thank you. And Lisa?
Good afternoon. I'm Lisa Merkel-Holguin. I'm also at the Kempe Center. And when I think back on my journey, I get to beat Colleen by about 3 or 4 years. I got 31 years in this field. And I'm only 27. So it's, how does that work? I was a social work student at a small college in Ohio. And when I saw this question shared with us in advance, I thought, what is the journey? And how can I think about where I started to where I am today? So my journey actually started in a social work class by a professor who I would now say was perpetuating health terrorism and was showing us the most egregious harmed children that made me want to go rescue them. And so I started as a child rescue person because of how I was indoctrinated by my social work educator. And I think towards the end of this presentation, hopefully you will see that I have transformed myself in my 30 some odd years to be very much in the alignment of we need to support families through policy, practices, legislative changes, because children are not separate from their family system, although oftentimes systems and society sometimes works to separate them. So that's a little bit about my journey. I've worked in a lot. I've done direct care. I've worked in some national organizations, doing a number of different things. And then for the last 10 years, I've now been at the Kempe Center.
Thank you, everybody, for those great introductions. So we're going to go ahead and start broad with our first question. So our first question is, what do you see as the most pressing issue facing child welfare today? And I'll just invite any of our panelists who are ready to answer to go ahead and jump in.
I would say having the old school mindset that Lisa spoke about, which is the white saviorism, having people that come from individualistic cultures, which is very Western Americanized cultures, working with collective cultures. There is a level of disrespect that is there. There's a level of not wanting to understand. I see white America being more of a domestic violence perpetrator and not being supportive. So the idea of having people that don't not only understand the families that are captured within the family regulation system, but also don't necessarily care to make any changes. I teach at the University of Denver Graduate School of Social Work, and I tell my students all the time, you are getting into the field of social work for you, to help you, to make you feel better. It's one of the most selfish degrees that you can get. And now we are at this pivotal moment where people of color are saying, hey, if you are going to be the ally and the allies of the communities, and we're asking you to step back or step away and work on your healing so we can work on ours, and we're seeing a lot of pushback. So I would say having people that come from individualistic cultures not respect collective cultures.
Thank you. Do any of our other panelists have thoughts?
I think for me, I've also had a huge transformation in the time that I've been working in this field. And I really, what MJ just shared really resonates for me. I feel like there has been this elephant in the room since child welfare started, in terms of how child welfare was, I believe, really started out from this kind of place of white saviorism, and continues to be perpetuated. So I think I kind of shifted my thinking. I used to say that, oh, this system is so broken. And I've really reframed it to think the system is doing exactly what it was designed to do. And I feel like there are people that are wanting to kind of address the elephant in the room, which makes me feel hopeful. Yet there's so many people who don't, in terms of like, why do you need to talk about power, privilege, and oppression in any of the classes that you're teaching related to child welfare? Because it's a thing. It's a big, big thing. And it's negatively impacting families that are disproportionately represented in our system, predominantly Black and Brown families, as well as LGBTQ individuals. And it has to change. So I think that is a huge barrier that we face right now.
So I'm just going to, I think, build on what MJ and Colleen said. And this is a $33 billion a year industry. It has capitalistic tendencies. Many of us have created a very nice middle class lifestyle for ourselves. And there are a lot of financial incentives to keep the system as it is. So I think that's kind of important to understand. because I agree that there are so many people that want to make change. And I kind of put people on a continuum. And so we have in this field now, abolitionists, right? And they are a growing segment of kind of voices saying we need to abolish what this is, because this is not working. It produces terrible outcomes, not just for the people who it quote unquote serves, but also for the workforce. I mean, for all the trauma that they experience, in the ways that the policies kind of suggest they have to perform or act or be with people. So we have our abolitionists, we have people that are like reformists, right? So like and on that span or in that group of people, I put people that are like massively want to do massive transformation, right? Like lots of big changes, major system reform, overhaul, et cetera, to people that are like, well, if we just tweak this one policy, or if we make this one program a little bit more effective, it'll be better. It'll be better. And then we have probably people who are like safety at all cost folks, or people who probably see themselves as, they're going to rescue the children from the family instead of trying to support the family for the child. And so why that's important is, and what I think actually one of the biggest challenges that we have in this kind of industry is we have a form of lateral oppression that is happening amongst these groups of people. So we fight with one another about, is it a small change, a big change? If we, do you abolish, do you rescue? And in doing that lateral oppression, nothing changes that's of considerable merit. And so this infighting, I think, kind of prevents meaningful change to come forward. And so I think we need, as a field, to start thinking about how you go from private knowing, like what do you know about what works, what doesn't work, what's unjust, what's unfair, how people's rights are trampled. Like social workers know that. People that are in the system know these things, but they know it privately. So I think we need to move from like private knowing to collective naming as a group, so that we can start to understand all these insidious oppressive structures that exist. And then we move to public reckoning, so that we can really build a political movement to make massive social policy change in this country that supports families. Otherwise, we'll be here in another 50 years. I won't, because I'll probably be 6 feet under, but some of the rest of you young'uns will be here, and we'll be having the same conversation.
I love this question. So my short answer is yes. That's the most pressing issue, yes. But this idea of competence, and that exists throughout, right? So I'm competent about your home. I'm competent about this, such a finite, such a terminal point of perspective, which doesn't allow for cultures, and I'm just adding to my colleagues have mentioned, cultures who collectively have learned to keep each other safe, to thrive. It doesn't allow for what has worked to seep into what is already happening within the system. On this idea of competency as well, or competence or know-it-all, this very Eurocentric Western way of being, right? Like my education is it, my religion is it, continues to permeate around throughout all the strata that exist within child welfare, which is also what may allow workers, may allow people who mean well to step into this place that is oppressive, right? So someone mentioned we eventually end up becoming that which we hate, right? And we may enter this field, I think we enter this field with good intent, then we have barriers around policy, barriers around just wanting to survive and thrive within a culture, acceptance of within that internal culture. So there is a lot that through competence, through this idea that I know best what's best for you, it allows us to somehow make it okay to then begin to practice in an oppressive manner, right? So just simply having the authority to knock on the door and begin to assess without any self-awareness, any awareness of the impact that it's created. Once we begin to realize that by humbling ourselves, both at the individual, at the immediate community, and both and at the systemic level, we can then maybe begin to have those types of conversations as to what it is that you need, right? And am I the right person to even be here? So I think for me, it's just that competence piece, along with the level of comfort that we do see across leadership, where for years and years, they've been comfy in those chairs, in those offices, and nobody has pushed against that. When we see all these movements of, we slap a sticker or a hashtag around equity, diversity, inclusion, but that's happening such at the floor level that it allows those who are nice and comfy and unchallenged to remain in that position. So those are two angles as to what I see would be most pressing from my perspective.
Thank you all for sharing. I really appreciate it. Before we go on to the next question, multiple of y'all mentioned barriers or specific or alluded to instances where these events could be occurring that are limiting those who child welfare is serving. But can one panelist give an example to those that may not know, like a specific instinct? I know, Adrian, you mentioned one, like knocking on doors without having the knowledge before or the competence before going in. But just for the audience to kind of get a specific example, can one of our panelists give one?
I can start. We just recently, this team just recently published a document, a paper on oppressive systems, and that's where your question took me. My collaboration within that was around immigration status and the attitudes that continue to grow in alignment with larger political agendas, larger visions that don't include people who look like me. One of the examples, and this comes up in training, this comes up in some of the other aspects of my work, is around, well, I can't provide the services that my undocumented and or clients who are supposed to be undocumented, yet we know so much about them. They don't have, I can't give them the access to services because either federal and or state policy prevents them because of that status that we've given them. So my challenge is always is, can you, or are you just not willing to, right? Because that also pushes against this idea of the lack of resources within county budgets. And I kind of recognize that, and I kind of like to challenge it, because the resources that everyone talks about is money, 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 right? And everybody wants to access other pools that are specifically set aside that don't necessarily have impact on county budgets. So my response is always is open up the checkbook, because you do have the capability of providing these services. It's just you're simply unwilling to as a result of that. So because that's what comes in my direction, that's what tells me is more of a more widespread reason and or barrier, or simply a smoke screen that people like to hide behind so that they can't say, if they don't provide the services, that they do have access and to provide via other methods that don't include Medicaid, et cetera.
Awesome, thank you. Oh, go ahead, MJ.
I talked in our collaboration paper about oppression. I talked specifically around the psychology field. I was working towards my PhD in international psychology, and really working towards that, even though I have my master's in social work, the idea and the prestige around psychology was really was glistening to me. That's what really grabbed my attention. When I saw and when I understood how psychology, like everything else, is weaponized against people of color specifically, it lost its illusion. It lost this shiny appeal to me. I am very proud of my colleagues that are colleagues of color that are getting their PhDs in the field of psychology. And I am comfortable with the American Psychological Association sending out an apology letter saying, oh, we're racist. And we've been racist. The conversation that we need to have in this field is if everything came to light as far as the research has supported, which is what people of color has been saying, that everyone is racist. The medical field, we know women of color are 3 times more likely to die. I am 3 times more likely to die given childbirth than my client, who is a white woman with a high school education with a meth addiction, right? I am still 3 times more likely to die. In the psychology field, the misdiagnosis, the idea that Adrian spoke of about competence, my organization, we don't subscribe to the idea of competence. We subscribe to respect. And there is a huge difference between competence and respect. Competence is saying, I know. Respect is saying, I am going to adhere to what your culture is. From an abolitionist standpoint, we believe in for us, by us. So we're not saying that there should not be a system. We're saying that if the colonization of white America has done more damage than good, and you have all the research to support that, then why are you still here? Why are you still doing damage, active damage? I would not have my child have a psychologist or a doctor or anyone that is not of our same culture and or ethnicity. It is dangerous for us. We know that it is physically dangerous. We know that white America gaslights us, right? We know that it is mentally dangerous. So with that being said, why must white Americans need to go into the white savior field of colonization within the family regulation system? The for us, by us mean that people that are more negatively impacted should be the ones to have the say. And if they are not, then we are all adhering to the white supremacy standards of colonization. So when I think about oppression, I think about what barriers have I put in place? What barriers have I upheld in being a professional in the family regulation system?
Thank you for sharing that. Really brought in a different perspective. I would just like to remind the participants, if you want to ask any questions or message in the chat, we encourage participation throughout the webinar, and we will also have time at the end for questions as well. We're going to go ahead and move on to our next question, which is, in which ways has the COVID-19 pandemic affected child welfare? And any of our panelists can go ahead and jump in.
I'll say a few things and then you guys can jump in as well. I think it's been a moment of reckoning. If you're willing to pay attention to what the sub stories are. So you have, again, going back to the camps in child welfare, you have a lot of hysteria that gets played out in the media from certain groups of mandated reporters that were projecting, once COVID happened, that we were going to have a huge surge in children who were abused or neglected, or that we wouldn't know about because they're now in their homes with their families who are likely perpetrating, atrocities on them, et cetera, et cetera. So this would be kind of like what our colleague and friend Richard Wexler from the National Child Protection Reform organization would say is a form of health terrorism, because it then makes the public, it creates this image in the public's mind that this is what's happening, that there are all these children who can't protect themselves who are now being harmed. So we had that happening. And then we had this other narrative that was happening. And it was the narrative of families who and I think this was documented by the Movement for Family Power and RISE out of New York City, two organizations that are really, I think it's fair to say, are more on the abolitionist end of kind of the spectrum, but do a lot of work around legal defense as well as policy advocacy, and then really bringing the voices of people with lived experience to the fore. And, you know, they had an interesting article that families who often are the ones that get the knocks at the door felt that they got a reprieve. They actually felt less traumatized because they knew that during a certain period of time, they were not going to be surveilled by the child welfare agency, which some have now kind of recast. Dorothy Roberts from the University of Pennsylvania has a new book coming out around, she's recast child welfare as kind of like the family policing system. And so there's probably truth in both stories, right? There probably were some children who were harmed, and there were a lot of families that were also didn't experience harm because we don't appreciate the trauma that this surveillance sets up within communities, particularly communities that are economically poor and Brown, Black, and Indigenous.
A different perspective around the workforce, right? So throughout Colorado, you saw different approaches, and it really brought a little bit closer to the surface the lack of care and interest on worker safety itself. Because there were people who were still responding to homes despite the high rates of transmission, et cetera. So even through this opportunity to sit back, humble ourselves down a little bit, there was still this forward push around, you need to be there, you need to police, you need to oversight, you need to oversee. So it also revealed what a lot of us who have been direct practitioners already know, is that we're more than just a means to an end. And the level of protection that I saw in some aspects just didn't quite rise to that level of, for the lack of wording, walking the talk, which is what we failed to do across all aspects, right? So that's what I noticed as it relates to the workforce, that the impact it was having. Now, what's the relationship with the theme of this? I'm struggling to find one, but then again, there are also people who are people of color, people who are from other backgrounds who had families who were impacted. So I imagine there was some sort of internal conflict around, now, is this something that I need to call on, or is this something that I need to provide support around? So, and it also flourished the idea that from a collective perspective, that families thrived and families did what they needed to do to get through the challenges that were being thrown in their direction: loss of job, loss of health, loss of a loved one, whatever that may have been. It really reinforced that point, that if we're able to humble ourselves down, one, take care of your people, and two, let people lead you in the direction that they need to go.
I think I would share, you've got me thinking, Adrian. I think it's been really interesting to just see how COVID in general has just impacted our world. And I think about even just the impact of like access to technology for kids who had to participate in school remotely, and how there was this, like the decision for kids to go remote was very very much based on classism and this assumption that everybody had access, like everybody has their own room at their house and everybody has their own laptop and really good internet. And, you know, so there's that thing that comes to mind and how that impacted our families and made school harder for parents who were already having to, you know, maybe work multiple jobs. And then they're trying to figure out, like, how can I do this safely? Because thinking about who the workforce, who was showing up as essential workers, so to speak, I think that had a big impact and a shift also in our workforce. It's been really fascinating to see. And I can only speak for Colorado because Colorado is the only state I've ever worked in. But in the entire time that I've been in this field, I have not seen turnover in the field of child welfare like I see now. Like, it is bad across the state of Colorado. And I think about, you know, what that might be related to. You know, there's like the great resignation that's happening right now across the country. And I think about what the impact is on families when they have, you know, get a new caseworker and they don't last. And then they get another caseworker and then another caseworker and another caseworker, and how that sets things back for families. And I think that that's interrelated to what has happened related to COVID. And I think the last thing that I would say is just this reckoning, just to kind of piggyback off of what Lisa said. I feel like there was the COVID pandemic and then also the pandemic related to kind of social justice awareness or whatnot related to the murder of George Floyd, and how I also see now more than ever more interest in our field related to wanting to do better. And our training system has been really intentional, as the Kempe Center has as well, about offering different learning experiences, whether it was our call to action to change child welfare conference, or whether it's just training through the Colorado Child Welfare Training System, for people to really be exploring, like, how can I do better, knowing that I work for this system where white supremacy is embedded in it. How can I do better as a worker? So lots of thoughts there related to the question that you asked. So thanks.
MJ, do you have any thoughts you want to share, or should I go ahead and move on to the next question? Move on to the next question. Okay, sounds great. So pivoting a little bit towards more of a solutions sort of mindset. Our next question is, how does one go about the pursuit of anti-racism and anti-oppression in child welfare?
I'll answer that. The idea of white Americans thinking that they should be the ones to lead this is essentially equivalent to, let's say we had a flat tire in our car and we're waiting for hours on the side of the road, we're calling AAA. And then the next day after everything is fixed, then your friend in the car was just like, oh, we had a spare already in the back. So you had the solution, but you kept the solution because that is how I see this. If you knew how to be anti-racist, then you probably would have did it. White America has to heal from them being oppressed. They have to heal. You cannot have the solutions. You cannot be a domestic violence perpetrator and then teach DV classes on how to heal from the trauma that I have induced on you as a domestic violence perpetrator. You can't. So the number one solution coming from the abolitionists, as a person of color, as a survivor of the family regulation system, is to be co-conspirators. You have to be a co-conspirator. The idea of allyship in the low morality in white America, people think that your proximity to people that are different means that you are within diversity or within inclusion. I always use myself as an example and say, you know, I had a mother that was two-spirited, a brother that was transgender, a lesbian sister, and a gay brother. Does that mean that I'm an ally to the LGBTQI2 community? I've never given up anything. I've never sacrificed anything for that population, ever. That doesn't make me an ally. It just means that I'm not an a-hole when I don't use derogatory language when I refer to them. The low morality of white Americans believe that they are good just because they happen to not incite violence. So I don't think white America has all the answers. I don't think that they know how to get there. So my recommendation would be to step out of the way, because we've had the answers and you've had the power. So what are you going to leverage? What are you going to sacrifice? I haven't really seen white people within a culture in America actually give up something for the betterment of others. And that's that individualistic culture. Collective cultures means that you sacrifice your individuality, you sacrifice your comfort for the betterment of others, for the betterment of your community. I have never seen that be an example within white America. And if collective cultures like Black, Indigenous, Latino, and so forth are the ones that are more negatively impacted by the family policing system, then why wouldn't we be the ones to have the answers? So stepping away from being a colonizer, stepping away from that mentality, me as a person of color, also colonizing mentality, believing that because I have a degree, I have the answers. People have been social workers before people of color were even allowed to be in social work schools, right? We were able to, just from that physical health piece, there were doulas and there was collective cultures that had their own way of supporting women giving birth to where, you know what, we didn't die. We didn't die. But now you have people that were only allowed to be physicians and doctors that are killing us. So coming from that community, coming from a collective culture, and coming from that piece of respect, that cultural respect, the best solution that I would recommend would to be step out of the way and to say, how can I help? What are you willing to sacrifice?
Thank you, MJ. That's where my head went, is like, what are you willing to let go of? Let go of whatever that is, right? And that also leads me to making an effort in identifying where you are in that journey and letting go of this idea that because I have taken an oath to 6 principles, that's a different webinar. Because I have taken an oath, that all of a sudden I am okay. It's like, no, it starts with you. It's knowing what triggers you, what you don't like, knowing what your decision making is coming from, knowing where this need to want to save and put a cape on comes from. It starts there. And once that journey is to a point where of comfort for yourself, is what does that look like outside of your immediate communities, outside of these echo chambers? Are you challenging people when they call people illegal? Are you challenging people when other people are being dehumanized? That's the work. And that together brings about this awareness as to, like, now I'm seeing what's happening at this systemic level, which is an even larger conversation. And it takes a lot more safety and it takes a lot more representation as to how to identify that, what needs to happen at that level, right? Like changing those who are making the decisions, even in panels and even across DEI movements. I see little representation of those who are they trying to represent. You see a white middle-aged man leading the movement of DEI, and you have zero color, you have zero sazon, zero flavor inside of your group. Like, that's just that hashtag, that's just that t-shirt, that's just that sticker on the back of your vehicle. That brings me back to, what are you willing to let go of? Because I like that chair, it looks comfy. Thank you.
Thank you. Colleen or Lisa, do either of you have anything that you'd like to add?
I think I agree so much about what both MJ and Adrian were saying, and I really appreciate their insights and their perspective. And I think so much of it is like, I hear child welfare professionals say like, but the system is so big, like there's so much to do. And it's this realization that you can make changes, just you. Like you don't have to wait around for the system to change. Like you have to go into action in order for the system to start making those ripples or setting little fires everywhere. We often say that on the team. And I think that can be kind of a cop-out, just to say, you know, it's just too big, you know, because then you're reinforcing this system of oppression. And I feel like that can be a cop-out big time. And just being accountable to yourself and to your colleagues and calling stuff out when you see it, because we all know, we've all been in meetings where we hear a microaggression or a decision made, and then we just sit there and feel uncomfortable. And I too work at the Graduate School of Social Work with MJ. We both teach power, privilege, and oppression. And I tell my social work students the first week of class, I don't care if you get an A in this class. Like that's not the point of this class, to make you a better social worker. I want you to be a better human being. And that's the thing, I think, is that we have to show up as better human beings in this field in order to start the ripple and kind of be the change that we want to see. So that's the only thing that I would add.
So in addition to those, and I concur, and maybe I'll just come at it from one more angle. So in addition to us taking personal responsibility for how we interact, how we see people, how we value those who we should be working in service of, we also have to think about massive system changes and trying to identify all these, what we labeled in our paper, structures of oppression that are embedded insidiously into the system, that people that are part of the system, I'm not just talking about workers, I'm talking about the administrators and the supervisors and the board, the board chairs, tens of thousands of people that are part of this industry have just taken for granted as this is how this system should operate, not thinking about deeply as to whether or not these mechanisms individually or collectively oppress or harm people. And so I think our paper did a pretty nice job of identifying some of them, but there are plenty more that could be identified for revision or elimination. And my favorite, and it's kind of what I've spent the majority of my career focusing in on, is who makes the decisions. And a colleague, Joan Pennell out of North Carolina State University, wrote, if you want to reverse systemic racism, then you need to change who is making the decisions. Because if it were your family that found themselves embroiled in the child welfare system, maybe you're an auntie to a child or a godparent, or maybe you're the mom or dad, or whatever the case may be, I guarantee you that you would prefer to be the driver of that decision than to have people who don't know your family, don't know your culture, don't know your story, don't know your history, don't know your strengths, your capabilities, your resilience, to be making that decision on your behalf. And so I think fundamentally, and it's a hard sell. We've been working at this for 25 years. And it's oftentimes, based on the premise that families have been, all families of every race, ethnicity, cultural group have been making decisions and safeguarding their children for generations. And so can we have enough humility to invite them for us to be invited into their place to support them in making decisions about what's best for kids and for what's best for their children and their family system.
Great, thank you. It looks like what MJ and some of our other panelists said sparked a question from an audience member related to this question. So I'll go ahead and read that out loud for our panelists. So Michelle Davis asked or said, I agree with MJ 100%. What are the ideas to reach across the aisle? when what white America hears, not what is said, that they are bad and wrong and the perpetrators of XYZ, how do we build collective power together to shift the system?
Can I jump in first? I have big feelings. Like, stop making it about yourself, white people. Like, it's not about you. That's the thing. And I'm a white person. I identify as white, but this gets me really fired up. It's like, we have to stop centering ourselves and let go of like the white fragility and the white guilt and the white tears, and just acknowledge like people who look like us have done horrible things. And we can choose to like wallow in our guilt and our tears and our fragility, which is centering ourselves, or we can decide to get to work. And so I get really fired up about that question. So Michelle, thank you so much. Thank you so much. It's like, stop centering ourselves and let's get to work.
Deep breath on this one. So this idea, yeah, it doesn't feel good to be called an oppressor. So the question is, then what are you? An oppressor or a perpetuator? That's a good question to start. I just don't have anything else objective to add on this I think.
Lisa or MJ, is there anything you'd like to add, or do you want us to go ahead and move on to our next question? No? Okay. So our next question, where are you seeing improvements or hope in the future of child welfare? And perhaps more specifically, anti-racism and anti-oppression.
I find so much hope in teaching students. What is out here is so outdated. A lot of young professionals will hear this. I've been doing this for, and then I'll give out this number of years as though people are supposed to gasp. I always tell my students, your clapback will always be, and what have you done to dismantle oppression and systemic racism in your 35 or 48 or 99 years that you've been doing this work? Because if they don't have a comeback with that, then you know that you are needed, because you will have comebacks, you will have solutions, you will be the solution. It is my job to make racism so uncomfortable that white people have to find comfort in not being racist. Because white America has always put their comfort before safety of anything and anyone else. In every sense, your comfort comes first. So let me help you find comfort in being anti-racist. Because you've been too comfortable, you as a culture, not you as an individual, you as in white American culture have been too comfortable with oppression, too comfortable with where you've been sitting. And it's really concerning that we don't have an understanding of the individualistic mindset of the centering. I don't allow my students to use BIPOC at all. Because as a Black person, as a Native person, as a Latino person, we all have different barriers of oppression that looks completely different, completely different. And when you use the term BIPOC, you continue to center whiteness and you other everything else. The idea of not centering whiteness really is hard for white America to not put them first. But it's done. It's done. You've had many, many years, many, many countries that have been colonized, many continents that have been colonized, and it's done. And we can move forward, but we have to get on it. And I believe the youth is what's going to bring it unapologetically. The youth brings it. I am very impressed with my students. I am very impressed with high school students, with middle school students that are not going to subscribe to the BS just because that's all we know. We know that we can do better. So I am very hopeful with this new generation that pushes me to do better, that pushes me to not oppress in the work in the field that I do, because as a professional, I am still upholding systemic racism. So you all as students are what's going to do and what's going to be the future.
Thank you, MJ. Lisa?
Yeah, I mean, agree with you 100%, MJ. I think there's some other reasons to be hopeful as well. The one that comes to mind is that we are starting to have these conversations are now happening at national policy and state level policy levels. I think that's encouraging. I think secondarily, right now, with even just this week, we saw that in the president's budget that came out from the Administration for Children and Families, there is a disincentive in child welfare to place children with kin. So let's say a child needs, the decision is made that a child should be in foster care. Of course, the corgis are going to start barking now, but what you get the idea is that, so the decision is made that a child needs to be placed. The way the federal funding system works is it's incentivized to place these children with strangers who some people would call foster parents and other people would call resource parents. But we need to start using language that is, I think, a little bit more descriptive to a child who doesn't know this person. You are a stranger. You might be a very well-intentioned stranger. You might be a stranger who has received training. You might, understand trauma, et cetera, but you are still a stranger. So we have incentivized placing children with strangers. The budget, this budget that just came out, which will require legislative change to make this policy real, is that it actually the formula will change so that it will be incentivized so that children, if they're placed with kin, actually the state gets a higher level of reimbursement. And if you're placed in a congregate care or group home, you get a 5% reduction. So there are some structural ways that I think are kind of exciting on the horizons. At least people are starting to have the conversations. And when you start seeing these types of structures and policies starting to get revised, I have hope, because I think that means that some of the messages around the harm that and the oppression that has happened, not just to families through this system, that there's some people who have some level of decision making and power, making some course corrections.
I find hope in the fact that these conversations have lasted past our 2-week attention span. It has outlasted the hashtag. It has outlasted all of that. As it comes to comfort, what I'm hopeful for is that we stop trying to dilute our content, trying to dilute these conversations, and in hopes of making other people comfortable for 60 minutes, where a lot of us, this is our live experiences. We don't get to say that. So I'm hopeful for that. I'm hopeful for the ability for us to now see movements beyond the hashtag. Thank you.
I love that, Adrian. And I agree, it gives me hope as well. And I just want to say that it seems like there's been some pullback by folks who look like me, by white folks. There's a term called white fatigue, where people just kind of like go back to status quo, and we can't do that, because there was a really great momentum, I think, that began with the murder of George Floyd, and that one of my colleagues at Kempe, Madison Davis, who I believe is on the call today, and gave us that amazing question, brought to our team's attention that while horrific what happened to George Floyd, we don't want to not pay attention to the lives that were lost before George Floyd and the lives that have been lost since George Floyd. And so I think I just want to put a challenge out to folks who are here today, or folks listening in, especially those who identify as white like myself, is to not flip the privilege privilege switch, because when we have white privilege, we get to opt in and out when it's convenient for us. And this has to be a daily commitment, not just when it's convenient. So that's just a challenge that I would offer people.
And we're going to go ahead and thank you so much, everyone, for answering those questions. We're going to go ahead and we have 2 questions before we end, and I would like to briefly touch on both of them. One is from Mary Paneer, who is asking, for those of us working directly with children, how do you suggest we approach the conversation of movement of anti-racism and anti-oppression with young people? And if just one of our panelists can answer that so we can get to the next question briefly.
Work with people that are already doing it. There are so many of us that is doing this work out here. You do not have to reinvent. You can not only get resources and ideas, but you can get support, because there are a lot of white people that feel isolated because they have this anti-racism mentality and they are shut down all the time. So you surround yourself with community that will continue to support you and to empower you to have those conversations.
Thank you, MJ. And our second question is from Lisa, and she is asking, given the shortage of social workers, educators, mental health providers, and others, what solutions should we push for with legislators and administrators to ensure that people of color are the ones making the decisions about these systems?
One idea that I have is when positions are posted, like I've seen a lot of positions for a lot of jobs that I'm like, that would be really cool for me to apply. And then I take a pause and say, I'm not going to apply. I'm going to reach out to a person of color or somebody who would be better suited to be in that position than myself. And so it's, again, getting out of the way and trying to support and, offer to, support that person in whatever way they feel like they would need the support in order to apply for a position, to get in those positions of power, to be in decision-making capacity.
Thank you, Colleen. MJ, do you have one last thing to add?
I just want to say that my foundation is that if you are not an ally of that population of people, if you are not a co-conspirator of that population of people that you are there to serve, then you don't deserve to be around them. You don't deserve to serve them. You are actually self-serving and you're doing it for you. And the only way you can be an ally or a co-conspirator is if that community welcomed you to. It's the only way. You don't get to say, I'm now the queen of ... and then put on your crown and everyone's like, who is this person? That's how it is whenever I hear random white people say, I'm an ally. You're queen of where? I don't know that country. So become an ally, become a co-conspirator, and then be welcomed into that community. That's what you do. That's how you do. If not, continue to work with people that just look and think like you. And I would be completely fine with that. I would support that decision 100%.
The only other thing, I mean, I hate to even come behind MJ after that answer, but I will just say one additional thing. And that is that we have to lean into the people who have been impacted by the system. And that includes white people as well. Poor, white, marginalized groups are also impacted. We have to hear from the parents, the extended family, as well as young people who have experienced, children and young people who have experienced care. We have to tap into their post-traumatic wisdom, which is what Bruce Perry and Oprah Winfrey wrote about in their book that was released last summer. And I think if we do that, we will have the ability, and we will learn how we can change, in my case, how I can be an ally to help change these systems.
Thank you all so much for answering those questions. We really appreciate it. We appreciate all of the panelists and the participants contributing to this important conversation. We hope that y'all have a wonderful rest of your day, and we'll see you next time. Thanks, everyone.